station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6:15. October is Breast Cancer Awareness Month, a great time to remind all of us about the importance of breast health and being proactive. And part of that includes knowing your risk for breast cancer. Joining us this morning is Baptist Health's Dr. Allen Cockerell with Sherwood Family Medical Center. Good to see you again.
Absolutely. Happy to be here.
This is the month where all the focus is on breast cancer, and it should be. Let's talk a little bit about the risk factors. Who is at risk for breast cancer?
Sure. I think, there's two main categories here, if you will. There are several at-risk individuals, unfortunately, with breast cancer, but there are two main categories, the chief being family history, especially in first-degree relatives, but not necessarily limited just to that either. So family history is really important here, especially of early breast cancer, and the other is women with dense breast tissues, right? So those two especially are two groups that we look at.
Right. So it seems like it has changed over the years. When is it recommended for women to get a mammogram?
Sure. So, and things do change. I will say, this is not my personal recommendation. That the changes that happen, thankfully, are well above me, right? With research councils and what goes into developing recommendations. Right now, the age is 40 is the recommended age to start screening breast cancer for all women. Some women, especially with different risk factors, maybe before that, but at least at age 40.
Right. And in addition to mammograms, we hear a lot about genetic testing as well.
Yes.
Talk a little bit, if you can, about that.
This is essentially kind of a new wave. It's not new technology necessarily, but it is really important to know that there are ways to help screen, besides just the traditional mammogram. That is still the bedrock and very important, but there are genetic tests available even in this area, right, that we can further risk stratify and be able to understand better from a molecular level, right, what genetics may play in breast cancer and breast cancer screening for you. Big shout out to Dr. Julia Turner, who staffs the high-risk breast and hereditary cancer clinic with Baptist. That's a hugely important clinic that looks at breast cancer and other cancers as well from a genetic standpoint. They do offer genetic testing, so this is not something you have to travel far for. It's right here. A lot of insurances do cover that. I respect them very much for what they do. They're hugely important and helpful with a lot of genetic testing for patients and their families. So if you have an interest in that, first of all, talk to your doctor about that, right? Absolutely.
Yeah.
For a referral, but also you can call them directly too. Their number should be at the Baptist main page there. So big shout out to Dr. Turner and her crew for helping out, especially from a genetic standpoint.
Yeah, I spoke with her just the other day. Really remarkable work that they do over there. Listen, if you have any questions at all, you can always contact Baptist Health by going to baptist-health.com or calling the number right there on your screen. The Baptist Health Healthline, it's 1-888-BAPTIST. That's 227-8478. Dr. Cockerell, thanks for being with us again.
Absolutely. Thank you.
Have a great day.